Low back pain is a major cause of disability in the United States of America. Here at Ortho Rehab, we look at several structures in the lumbopelvic system and make sure we do a 15-step thorough evaluation to see exactly how those structures are functioning, how they respond to mechanical loading, and what we may need to do in a proposed treatment plan for each individual patient. So the structures that we primarily focus on are the facet joints that are the connection in the posterior aspect or back of the spine, the relationship of the nerve roots with the intervertebral disc, and if the nerve roots are being compressed or irritated in those areas, as well as the general relationship of the spine with the pelvic joints. We can also have problems here in the pelvis itself, or the sacroiliac joint. And as you can see, the sacroiliac joint, which is the connection or articulation between the ilium of the innominate bone and the sacrum itself, is not far away from the lower lumbar segments. We can have an overstretch of the ligamentous structures and the pelvic girdle, this being the sacrotuberous ligament, the dorsal sacroiliac ligaments, as well as the sacrospinous ligament. This will cause us to have pain when we're in the sitting position, or when we're doing a sustained loading and forward bending of the pelvic girdle under the lumbar spine. Now, let's go back up to the lumbar spine for a second. A major cause of irritation could be because the segments are moving too much in and of themselves, okay? And the segments are going to have smaller ligaments that connect these joints together, as well as the interspinous connections. That's the projections of the bones posteriorly, and these gutters serve as a major connection point for the larger muscles in the lumbar spine. One of the main muscle groups in the lumbar spine, which Bogduk and Tillman call 60% of the stability of the lumbar spine, are the multifidus muscles, or the transversal spinal muscles. And those muscles go from the transverse process below, superior and medial, and are very thick and act like a rotator cuff type muscle group for the spine itself. Now, superficial to those, we'll have the erector spinae group that cover them up, that are responsible for the larger motion patterns of the spine. If you have low back pain or pain in the pelvic girdle, we may be able to help you. So come see us at Orthopedic Rehabilitation and Specialty Centers for a thorough evaluation and a treatment program that's specifically designed for you. I'm Rob Tillman, Clinical Specialist with Ortho Rehab and Specialty Centers, and that's today's Ortho Bite.